So what has Catherine Zeta-Jones got to do with bipolar disorder? Well, she was herself diagnosed with bipolar disorder in 2011 onwards time, and that's what we're going to be discussing today on what is bipolar disorder, how do we treat it, how do we manage it, what can you do to improve the condition. So we talked about the bipolar disorder, the diagnosis and the treatment modalities in the previous video. This video, let us talk about the impact of this disorder on your daily life. So someone with bipolar disorder can have various aspects of their daily life, including their work, their relationships, their social life, their self-esteem, their family relationships, their friendships. A huge variety of aspects of their life can be affected by this disorder, where because of the symptoms, they may not be in a position to attend work. The absenteeism from work can go up. They may enter into arguments or have difficulties in maintaining or establishing relationships. And the disorder itself may have a negative effect on their self-esteem. So all of these things have to be kept in mind when we start designing a treatment plan for the individual who's suffering with a bipolar disorder. It is very, very important to have a supportive environment and understanding from your friends and family, which means that when we start thinking of managing the condition, your close family members or your friends who are there to support you need to have an understanding of this disorder, and we can sit down and look at what we call as relapse signatures, which means that what are those triggers that lead to a relapse of this condition, because the sooner we identify those relapse triggers, the sooner we can have strategies in place to mitigate those triggers and help not getting into a full-blown relapse, but managing the condition early on. Some of the other coping strategies that one can use include maintaining a regular sleep. Many times in my experience, I've seen that people, one of the earliest relapse signatures is that their sleep gets disturbed. And if they are not able to sleep enough, that might trigger a relapse of the episode of bipolar disorder. So maintaining a regular sleep schedule is very, very important. Trying to engage in all kinds of stress-reducing activities, be it exercise, sport, your interests and hobbies, that's something that keeps you going and keeps you well. So that on its own will reduce your stress levels. Then building up the support system around you, which is often of friends, families, or for that matter, any of the professional services who are there to help and support the individual, would be very, very important. If you are in the NHS and with the mental health teams, you would often have a detailed care plan to manage your condition. But if not, then that support system and having a care plan anyway is an important aspect of managing this condition. In summary, what we've talked about is bipolar disorder is a disorder which has two poles. It is fundamentally a mood disorder, where the first mood can be of a manic or a hypomanic, and the other pole can be that of depression. We have to understand that you have to go and seek help if you suspect that any of your friends or family or relationships, any of them have any of these symptoms, then I would encourage you to go and seek professional help and get it seen as soon as possible so that the treatments can be tailored for that individual. With medication, with all the support that is available for bipolar disorder, there can be a huge improvement in the quality of life that people have with this disorder, and that can in turn make your functioning far better than when someone is having a relapse of the condition. So thanks for watching this video right till the end. If you found that information to be helpful, please do not forget to like and subscribe and press that bell icon so that you can get all the notifications of all the upcoming latest videos on this channel.